Please enjoy our podcast, but remember our doctors are only here to educate, not diagnose.
We are back. A couple of housekeeping things before we do move on to our special guest today. Dr. Matt's not here. He's out of town doing whatever Dr. Matt does. And then Kimberly, who did just a wonderful job of organizing the podcast and capturing the speakers, like lure them in with food.
Making sure the memory stick didn't disappear.
Yeah, I've already lost it. And then darting, potential people. She has moved on to bigger projects than us. And we just want to thank Kim for just really all the work that she did. Just a wonderful human being. So she's out there doing her marketing somewhere in the great big world. Pour one out for Kim tonight, if you're listening. So, Dr. Matt is going to be taking over some aspects of the podcast, moving on. So nothing is really going to change, except for we won't be harassing Kim as much. We're still harassing her, just from a distance.
Right.
All right. So the other day, I'm out. Right, we're out seeing patients. We're getting absolutely clobbered this time of year, like we always do. And then I look over, and then in Dr. Amanda's the baby-atorium, the baby arena, where she wrangles them. We have a special little area built for her over there, and there's babies everywhere. And then I saw two moms with babies waiting, and there was like 8 babies here. And there's always babies in and out of here. But we have some special therapies that Dr. Amanda has been doing, so I knew we had to get her on to talk about it. And for those of you who've been with the podcast for a while, you will know that Dr. Amanda and Dr. Danielle, our new doctors, they're hard to get to talk about themselves. They're not nearly as good at talking about themselves as I am.
We're humble.
Yeah, and that will leave them. Usually by their second year, doctors turn into just raging, what. So anyway, we got her. I want her to talk about the stuff that she's doing. We have a lot of moms. We have a lot of questions about this. And I'm telling you, these babies are lining up out the door like they're lining up for gas. You know what I mean? And so Dr. Maurer and I...
With gas.
Yeah, there's plenty of gas. So,
free.
We'll get to the questions, but Dr. Drum... Congratulations on your baby. I don't think you've been back since you had your baby. For those who don't know, Dr. Drum had a grade A plus cutie. Raina, who just has...
We'll probably have her on the podcast.
Absolutely. And she has this office wrapped around her finger.
She would have been here today, except for nap was more important.
So. I'm with her on that. And then it's like, that baby is either going to be a doctor by the time she's 16... or she'll be a government assassin, because she's going to have so many skill sets and meet so many people. It's funny, you look over there and Dr. Drum's treating a baby, and then Dr. Drum's baby is there. And it's the most wholesome. It's like instantly a cardigan sweater sprouts on your body, because it's the most wholesome thing you could just witness. It's just the coolest thing going on. So anyway, how's your first year going?
Good. It's been a lot busier than I ever expected, especially coming back from having my own baby.
That's what I was saying.
I went from 0 to 100 really fast.
You super did.
And honestly, it's because of what we're going to talk about today.
Yeah.
Everyone in here is incredible in their own way, but we're seeing a ton of tongue ties.
Yeah, it's just...
plain and simple. Tongue ties are ruling the world right now.
It is so weird. It's like, it goes in these waves, When I was very first in practice, it was, what was it? Hip dysplasia. Yeah. And then it was skulls, right? Misshapen skulls.
We still have a lot of those.
Yeah, so it's fake. Yeah, and it's like, you see these waves of, where did these come from? How could all these people have hip dysplasia? It's been around for, we've known about it, it's been checking, and all of a sudden it just doesn't get checked and it starts showing up in our offices. And you get one, and she tells her 4 friends, and now you can't close.
Right.
Because there's people, when you go to eat, there's people there that have that. And so what Dr. Drum's going to talk about, it's really one of the neatest things. So we got a couple questions we're going to elucidate it. So do you want to start just by opening with tongue tie? Just talk about it for a second, and then we'll talk about the specifics of it?
Yeah, sure. Honestly, I didn't really know a lot about it before Raina, actually. Right. Raina was lip and tongue tied.
Oh,
so
okay.
I kind of fell into this hole with her.
Yeah, there's nothing like when it's your...
Yeah, so actually the dentist that I work with to do the revisions has a speech pathologist in her office as well.
That's awesome.
Who Raina saw before her surgery, and then the dentist did their revision for me. And then we kind of just felt that I was the missing piece of the puzzle, and so I did the cranial stuff that they were not able to do, and we just saw a incredible result with Raina.
Yeah, so it's like so there's like it's just 3 women just dominating.
We're just taking over.
What the
Tongue
heck?
Ties. Yeah. Yeah. So it's
they don't get to rest now.
no.
It's nuts.
No,
you
it's
know.
crazy. So yeah, really those 2 introduced this topic to me, and so I did a lot of research, and they've been around for a long time, like you said, but no one really did anything about them. I'm sure all 3 of us, at least one of us, is tied.
Oh yeah,
it's me.
Oh yeah.
So they are hereditary. It is a midline deformity. Jared is also tied, so we just kind of knew Raina was going to be tied.
Yeah.
But yeah, it's nothing crazy. If it happens to your baby, don't freak out. We'll talk about it. But yeah, what chiropractic, speech pathology, lactation consultants, and a revision can do is incredible.
Awesome. Now, when you say a revision, we got to get into that, aren't we?
Yeah. So
okay, cool.
A frenectomy. So they're actually going to go and laser the tissue and make it looser.
Okay. So let's talk about. Let's get into the basics. So, for the people. We talk about frenectomy, we talk about tongue motion, and we talk about cranial nerves. So can you talk about the specific one we're today, just so the people know, so they can imagine it in their head?
Yeah, so as chiropractors, we focus on the nervous system, and there are 12 cranial nerves. The tongue is actually innervated or is controlled by 2 cranial nerves.
Yeah, it's super important.
Swallowing being cranial nerve number 9, the glossopharyngeal, and then the chewing motion or breaking food apart in our mouth is the 5th cranial nerve, which is the trigeminal nerve.
It's our big one.
Yeah, there's
like
3
his
branches of
nucleus
him.
is
He's
like
crazy.
he's got holes in your skull.
Yep.
There's no the skull doesn't like it. He's like, we don't do holes. So if you get an opening, you're important.
Yeah.
And the trigeminal's got like 3.
3.
It's stupid.
3 branches.
It's by far the most important.
Yeah, so...
And my favorite.
The biggest
all right.
one.
My favorite cranial nerve.
Yeah. 5 also does motor and sensory, so he's a big deal.
He's awesome.
So now getting into, I guess, more like layman's terms for the parents.
Yeah.
What is tongue tie?
Or male doctors.
Or male doctors.
Right.
What is tongue tie, and why does it matter? Like, why? How does it affect the baby and nursing and all that good stuff?
Yeah, so tongue tie is actually called ankyloglossia. That's the big scary word that dentists will throw at you, and you're like, wait, what? I don't know what that means. It really just means that the tongue is restricted and it cannot move properly. The tongue should be a free muscle that just goes up, down, side to side. You can reach the top of your mouth with it. It helps you swallow. It helps you breathe. If it is tied, the tissue underneath the tongue will be tight. You'll see most babies won't be able to stick their tongue out or to the top of the mouth. And that is when we talk about frenectomies, that is what we are releasing, is that tight band of tissue underneath the tongue. It is super important that the tongue is free, especially when feeding, because that is part of how we get a good latch. Moms who are breastfeeding know that if we do not have a good latch, that's usually what ends their breastfeeding career.
Yeah.
And it's super sad. It's brutal. I know firsthand I was about to give up, and then we had the revision, and I'm super glad that we did.
Yeah, it's a big, big deal. Like, emotionally.
Yeah, it really is. Like, you come out and you're like, oh, I had this baby. It's going to be easy. Breastfeeding is like
Wilder,
natural.
You know what I'm saying?
Yeah, I mean, it's natural, but it's brutal.
Oh, yeah.
Like, it's terrible.
Yeah.
So
that's why we're on this side of the table.
Right.
I look down a lot. So that way I don't feel like,
Yeah. But with breastfeeding, the first signs that you will see as a mom, if you are having a tied baby, will be you'll hear a lot of clicking, a lot of smacking. Your breasts will be red, swollen, cracking, bleeding. You'll be like, absolutely get this baby away from me. I do not want to do this anymore.
God, that's gotta be so frustrating.
Yeah, and most times pediatricians will just say, oh, you're learning.
Yeah.
And that is never an acceptable answer.
Like they blame it on the mother as opposed to...
Yeah.
I've seen so many, and I'm not even working with your patients, and I can see them.
Yeah.
I can see their eyes, because they are beat down. They're like, I can't feed my baby. Like you can feel it, and it's like, holy cow, that poor thing. You just want to hug them, but it'd be inappropriate. But still, you do, and it's like, and then when you're done, like that mom yesterday, like holy cow, she floated out of here, man. That was
go from feeling like it's their fault to realizing there's a fix.
And that's what drives me crazy. Like, you had to find somebody. Nobody told you, but like you're the doctor,
right?
How many billions are out there that aren't you, that don't know? Like, even the ones that listen to our podcast, that's great, but like, holy cow, it's frustrating. Oh, that would drive me crazy. Well, that drives me. Yeah. Okay, sorry, go ahead.
It is frustrating, especially when, day one, they're like, oh, you'll just have to supplement with formula. And you're like, no, there's got to be something more.
I just hate that.
Yeah.
Like when, man, that very first, and we have tons of good medical doctors that we take care of here, and they're wonderful people, but man, the first, I'm on pediatrician number 9. The first one I went to, I was asking him about my oldest son. I'm like, he's kind of gurgling at night. And he wrote him a prescription for Prevacid. And I was like, this is my worst nightmare. Like, you didn't even do an exam. No, he did an exam. He pinched his nose. So proving it pretty. He didn't tell us what he was going to do. He just reached down and pinched the kid's nose. I was less refined than I am now. And man, I was hot. Boy, I just couldn't believe it. I was like, you got to explain to the parents what's going on. You can't just... Anyway, yeah.
You do.
So just to hear like, oh, no, formula it is. And you're like, you're not even giving this a chance. There's got to be something else.
Yeah.
God dang. Okay, so
moms, you'll see what I just said. But with babies, sometimes parents don't even know what they're looking for. They're just saying, oh, my baby has gas. Or, oh, my baby has reflux. Or, oh, my baby hates tummy time. Or, oh, we can't get him to sleep through the night. Or, oh, they're not rolling. Or some kind of symptom they're coming in here, not, oh, my baby has a tie. 9 times out of 10, with all those symptoms, it is actually a tie. It could be tongue tie, or we also have the lip tie, which is the upper lip frenulum is too tight, and you can't open the lip all the way. It should touch like the tip of your nose. Sometimes that is what causes an improper latch, and that's when we see the swallowing of a lot of air, causing gas. So that's a big one. And we also see buccal ties, which is the muscles of the cheek. Sometimes it's bilateral or on both sides. Sometimes it's left side's tighter than right side.
Man, I've seen this stuff.
It's crazy, and it's just so amazing how long the tongue tissue is. It literally goes all the way from the tongue or the mouth all the way down to the big toe. Yeah. So there could be, gait problems later on when they're starting to walk. Yeah. There could be an extra injury down the road because the tissue is tethered. Like, it's just incredible. The body's incredible.
It is really neat. Like, we look at the mesoderm and the ectoderm and how they form into the neural canal, but then I hadn't even considered the implications to the glossal tissue. So that's really cool. Yeah, that's really cool. So the parents, they're like, "Oh my God, it's crazy." So then they get it checked out. The your little baby has a tongue tie or a lip tie. What are the most important? Like, just 3 things about the procedure that the parents need to know. Yeah. That you answer every single day.
Yeah. So first, some ties don't actually need to be revised. They're called a functional tie, meaning that yes, it is tight, but we can do some oral motor functional stretching and exercises to get the tongue to be able to move how it should. That again, you'll be seeing me, the speech pathologist, to work kind of through that. And if they do need a revision, it is okay. I know, like, oh, my baby's a week old or 3 weeks old.
Are you crazy?
They're going to have surgery.
Like, I'll fight a person,
Yeah, but it really is okay. It is 10 seconds, honestly, with the laser. It's just super quick. Get in and get it out. The baby, yes, will cry, but it's more that they're swaddled and there's cute little laser glasses on them. But
God, I love it.
It's totally okay. There's nothing that we could have done as parents to prevent being tied. That's is really what it important. Is. Like, it happens.
What are you going to do?
It's okay, and we're here to help you. Sometimes when we get a revision or a surgery, any surgery, honestly, we think, oh, this is going to be the magic fix. This is going to be it. Yeah. We're not going to have to work anymore. It's just going to be perfect, which in some cases you can see immediate outcomes being beneficial, and other times you have to do a lot more therapy post-revision to strengthen the muscles that you just freed up that were not working properly in the beginning. So don't be like, oh shoot, this didn't work, because it's definitely long term.
And you have to make sure it doesn't reset a little bit. Like that scar tissue is gummy.
Right. So that's why.
And along those lines, what does the aftercare look like, or after procedure? Like, is there stuff the parents need to do?
Yes.
Are they returning for care?
Yep. So before procedure, we do like to have, a lot of therapy done to help the surgery.
A lot of finger cuts.
Lots of finger cuts, lots of gloves, lots of everything that I go through
here
in the office.
Babies yelling.
Yes. Yeah. Everyone loves my finger cuts, but
they do. Little kids, they see them over there and they're like, they have to
puppets.
have them. I saw Dr. Matt screwing with them the other day.
Yeah.
It was me.
Oh, it was you.
I couldn't help myself.
Yeah.
Well, she's got cool stuff over there at the baby area. We're like being driven back with sticks because we're just going to screw everything up.
So after revisions, there are exercises specific for tongue, lip, and cheek that will be given by me and the dentist. The dentist does a really cool video that you get to watch beforehand, but obviously it's a lot of words happening at one time, so you get a little panicked. But we all give the exact same exercises to do post-surgery. It's a lot. It's 6 times a day, 3 sets of each stretch. But they are super, super important so that we do not get reattachment.
Right.
Now, the laser that she uses is extremely good. It's the best way to have a revision done. Some people do like scissor snips and stuff on the frenulum. And
I was going to say, back in the day, that's how it was done.
Yeah, and so we see a high reattachment level with that because you're not actually obliterating tissue. You're just kind of cutting it. And tissue wants to meet tissue to reheal, so it's really hard. And you're
laying it right back down on there.
Yeah, so with the laser, it's a lot easier to keep the way that we want it to be. So
that is interesting. I didn't think about that. Like you're removing tissue.
It's gone.
Yeah.
Yeah. But so you'll get exercises. You'll still have follow-up appointments with me, the speech pathologist, and the dentist for a couple visits, just to make sure that you're doing the stretches correctly, that the wound is healing good, there's no infection, anything like that. Right afterwards, you might notice that the baby is kind of sore, kind of fussy, might be super sleepy, wants to eat and cuddle a lot, and that is all totally normal.
Right.
Just let it happen. Don't try to force the baby to stay awake. Feed if the baby wants to feed.
Yeah, it's weird. Some of the things, like, I got to stay awake. Like, don't fall asleep. No, that's
just let them.
Like what?
Yes, it's biologically okay to let the baby
got to
do
repair.
what they want.
Like, we want to repair mode now. Well, that's when you're asleep.
Yeah.
That's wild, man.
Yeah.
It's just the coolest thing. It's got to feel pretty empowering for you to make such a impact.
It really is cool.
Because good chiropractic is good. But it takes a little bit, especially if you're remodeling ligaments. You can only move that ligament so far every 7 to 10 days.
Yeah.
But man, that baby can't feed. A week later, that baby's feeding.
Yeah.
They're mad when you're doing it. When you're doing the therapy, they're like, hey. But man, I just to see the look on these moms' faces makes it so. It's really neat. I'm a little jealous.
I would say, and just in the past week, I've had 6 moms tear up just because they're able to keep breastfeeding, and it's so awesome.
I mean, are you like
huge?
Yeah,
it's a big deal, man.
It's a lot of appointments. It's not exactly the cheapest thing that you want to do after having a baby,
right? Especially because you just had a baby. Like now, I got to do all this, but when you're done, you're like, oh my! And then you got another however many months.
Yeah,
I'm gonna say to enjoy it, but that's really not the.
Well, you enjoy it because then you get to watch him eat solid foods correctly too. If you're tired,
oh, that's true.
You're impaired with eating solid foods, lots of choking, lots of all the things that you don't want. So, I mean, it's just a win-win for everyone.
It's awesome. How do they? What do they do if they suspect the tie? Then what?
Yeah, if we have a parent listening right now and they're like, "Oh my gosh,
yeah,
this is what's going on."
What if you're an adult and you did all that when you were little?
Well, what if you're an adult and want it to be revised right now? Sure.
Do you do that?
Yeah.
And then do you do the therapy on them?
Yeah.
Whoa.
I'm actually considering getting mine done too, just to see.
Are you gonna do the therapy on yourself?
No.
Let me make my eyes water. You show me how to do it.
Sure.
Or Jared.
You have to be. Oh God, not Jared.
That's your husband. Yeah. All right.
No, I think we should. I think we should make a case study out of this.
But yeah, we have so many ideas for case. But so yeah, for adults too.
Yeah.
That's wow.
But yeah, so if you think baby's tied, definitely call a provider. Love pediatricians, but they are not taught about ties at all.
Isn't that nuts?
Let me say it one more time. They have no idea about ties.
Right.
So they most likely will look at it and be like, oh, your baby's fine.
Right. It's nuts.
Again.
You think, okay, Channel 5 News, they're going to interview someone about health. It's got to be a medical doctor.
Yeah.
Channel 5 News, they're going to interview someone about nutrition. It's got to be a medical doctor. They get nothing.
No, they have no idea.
They get nothing on this. And it's like, Channel 5 News, what are you doing?
Yep. Yeah. So please don't go to your pediatrician and ask about ties. Please call a pediatric dentist.
Yeah.
I have cards here that is the dentist that I work with every day, honestly.
Here lately, it's every single day.
Yeah, a pediatric chiropractor who actually is specialized in pediatrics. Don't just go to someone that says they know what they're doing, because again, they aren't trained in ties.
Yeah, like just like this work we're doing with discs and with spondylolisthesis and all this other stuff. It's 4 years old.
Yeah.
The case studies are 4 years old. The stuff you're looking at isn't even that old.
No.
So it's a big deal.
Yeah, just please go to someone who's qualified.
Just,
That's literally bottom line. I don't know what else
you don't have
to
to come
say.
here, but you should. But you don't have to.
Yeah.
But go to somebody that knows what they're doing.
Yeah.
Look at your little baby.
Yeah, and honestly, if you do go to your pediatrician and they say, no, they're fine, and you're still seeing that the baby's colicky, fussy, whatever, get a second opinion. There's no harm in getting a second opinion.
Get like
also,
19 opinions.
Your pediatrician does not run you or your baby. You hire them. So if you don't agree with something, you can totally do your own research.
That's it.
Even me, like I tell that to all my patients, challenge me. I'm
Yeah.
totally up for it.
Good doctors are the ones giving the information,
Yeah.
not getting mad about it.
Yeah, so,
Nice. Good tie-in.
yeah.
Pun intended.
Tie-in.
Oh my
Thanks.
goodness.
Okay, very good. You did great. Thank you, Dr. Drum,
No problem.
for your forced interview. I have to get this information out there because it just is so important for these moms. And begrudgingly, I will admit that our most listened to podcast
It's me.
and the babies in the pool,
Yep.
which is ridiculous.
Which Rain is signed up to do.
Oh, I bet. Are you gonna have that lady back? You guys gonna do a second? I guess did you do another one?
We said that we would do another one, kind of like, again, me and my experience with her
Yeah.
to bring awareness to
Well,
them.
you could have your own special podcast.
And what was that? A couple weeks ago, we were looking at. It was a line graph showing.
Oh yeah.
They were like, "Oh, what's that one?" Then we
Yeah,
like,
and
spiked
you knew
way up.
what it was.
I guessed right away. I was like,
oh, I
"That's
know,
not ours."
I know that
me.
one. Yeah, we're getting 100 something. Like we have a really good podcast, but like there's one podcast that just dwarfs everything else, and it's like that is not the podcast any of us were on. I know,
I'm
but
sorry
still.
that I am just
I am
ruling
sorry.
the world right
Because
now.
yeah, like before you replaced me on the floor. Like I used to do all the babies, and now I send them to you, and I'm just so proud of you. I'm so proud of you. Like you walked in our office years ago, and you were like, "Oh my God, don't even
Unwillingly.
don't come anywhere near me," you
Yeah.
know. And I was like, "Well, let's talk about it. What? And you had a bunch of questions, and I answered them, and then now you're just the best. I just am so proud of you.
Thank you.
All right. Well, for Dr. Drum, for Dr. Brad, and for myself, thank you guys for listening, and we will be back in 2 weeks. Bye.
And a big thank you goes out to Hug Monster Sound for somehow allowing the doctors' voices to sound even better than they already do.